All right. Welcome to the OSU's Exercise is Medicine Wellness webinar. That is a mouthful. I have the pleasure tonight of introducing our very own Nick Fields, one of our exercise specialists, who is going to be talking with us tonight about integrating wearable technology into your workouts and how you can benefit from that. So, Nick, I'll let you go ahead and take it from here. If anybody has questions, go ahead and put them in the chat, and Nick and I will monitor that and get to those questions.
Awesome. Thanks, Kelly. How's it going, everybody? Like Kelly said, my name's Nick. I'm going to be leading the webinar today. We're going to talk through hopefully a pretty casual conversation just about wearable technology and the whole new kind of exciting world of wearables. What they are, what they aren't, how we can use them, how we shouldn't use them. There's lots of kind of guidelines and even things that I've experienced, working with myself and working with participants and patients alike. So yeah, we're going to talk about integrating wearable technology in health and wellness. Just a little background on me. I'm an exercise physiologist and I'm an exercise medicine specialist here with the program. So I help do this program at our community partner sites as well as the Upper Arlington location. So if you have or will go to either one of those, you'll see my face. I'm also helping on board for we got a Smart Columbus grant to work with Garmin. And so we're rolling out Garmin wearables, hence integration of wearable technology, out at one or two of our community partner sites on the Near East side. That's my wife Gianna and I in this summer in Italy. So that's what I look like when I'm not at work. Maybe I don't know. Yeah, I'm excited to chat with you guys today. Like Kelly said, if you have any questions, feel free to throw them in the chat, and we can talk a little bit more specifically about you and your situation if you have a question. All right, we're gonna go right into it. So, simple question: what are wearables? Wearables are essentially anything that we use to track our fitness, to provide a greater insight into what's going on with our bodies, having better access to them. And we can use that across a whole wide variety of disciplines, whether that be like you see there, exercise and fitness tracking. I think that's kind of the most common use or what we think of when we think of wearables, is using them for exercise, health, and fitness tracking. Health and lifestyle management. So, looking at your heart rate, looking at a couple different things. We'll talk about that later. Kind of some new things that we're seeing that are being integrated into these wearables, or even some risk and fall alerts. I know I've worked with patients in the past who are using specifically the Apple brand. I've seen that a good amount. That monitor, if you're at a risk for falls, if you've been in a car accident, those sorts of things. They can do some pretty interesting stuff for just kind of general safety overall. And then, yeah, technological advancements. So as all of these kind of technology companies, they're always getting better at selling and also making better products. So they're consistently making changes and advancements, making these things better, integrating with your, even if you have a smartphone that you're connecting this wearable to, lots of really cool things. And it kind of depends on what brand that you're using and what you end up wanting to use it for. We're going to talk a lot about that today. So wearable options, this is just kind of if you were to take maybe some of the most popular wearables that you would see out. I may have missed a couple. There is tons, right? You can get as many. You could probably name as many as you possibly wanted to. But ones that I see really often, with patients or even, by myself, right? Apple Watch is in that top right corner. Garmin series, that's personally what I wear, but we'll talk more about that in a minute. Fitbit, that's a really common one. Samsung Smart Series. Whoop, which is down in that bottom left corner, maybe a little less common, but is a little bit more niche. Same with that Coros series. And some of these are watches. Obviously, see a lot of watches, but same with that Whoop, and then that Garmin thing right there on the bottom. That's a heart rate monitor that you wear around your chest. So there's tons of different wearable options. I know one that's really common is also like the Aura ring, I think it's called, that people wear. That's literally just like a ring that you wear on your finger that gives you kind of cool insights. So maybe you're in the market for one, or you're just trying to learn some new stuff. There's tons of different options, and all of them kind of do a little bit of have a different idea behind them, and do different things better than the other. So let's head into kind of what can wearables do, right? There's lots of different brands and lots of different things that can work. But as a general consensus, the kinds of things that these wearables focus on, it can look at your heart rate, right? It can see your resting heart rate. It can see heart rate during activity. It can see, kind of changing how your heart rate progresses over time. If you're doing, workouts, it can look at your distance, your duration, your pace. Usually that uses GPS technology in most of these in these wearables, but it can give you good insights into what's going on there. Exercise minutes per week. If you've come to some of these before or you've been involved in some exercise yourself, you may know that the ACSM recommended exercise dose per week is 150 minutes of moderate intensity. In a lot of these wearables, that's integrated into the kind of curriculum and the system that it uses. And so it can count that for you as opposed to, if you're really working at getting that 150 minutes a week, having to keep track of it yourself. A new kind of newer thing that's it's working on trying to reduce your sedentary time, or at least give you alerts to know kind of what you're doing. Move alerts if you've been sitting there for a long time. Breathe alerts. I know that's something that people get all the time and kind of laugh about. My watch is telling me to breathe. That's kind of funny. A lot of these things can do really good sleep tracking to know, when you're in different cycles and how you slept the night before, how that might progress through the rest of the day. Obviously, the most common one that you've probably heard of is steps. How many steps did I get this day? Did I get my 10,000? Did I get my 5,000? How many can I get in a day? I already touched on, falls and accidents. Heart rate variability is a relatively new thing, and it's not super common in every wearable, but some of the top of the line ones in different companies have it. Whoop is one, Garmin is one, I believe Apple has it. But some heart rate variability can be a really cool data point to kind of take into account your recovery, your exercise, your overall kind of health and fitness. And then the last one that I think is the most important is progress, right? So as we wear these wearables, it collects data, right? And it sees, hey, what are you doing? What kind of workouts are you doing? How is your recovery? How's your sleep? And it gives it there's a cool kind of feature where you're able to look back into time and kind of see, okay, how was I doing 6 months ago? If I went on this same walk 6 months ago, am I now able to do it a little bit faster? Maybe my heart rate's down a little bit. Maybe my steps are trending in an upwards direction over time. I think that's actually the most beneficial thing. And we're going to talk about that in a minute. But yeah, there is no limit to what these things can track. I think one of the important things to think about, though, is what wearables cannot track, right? You might have heard of like people getting super obsessed with their wearables or with their phones, or if it's not on the watch, I didn't do it, or if I didn't record it, it didn't happen. I think that's something that's really important not to think about and use it more as a tool. It is incapable of doing things like checking your blood pressure. There is some kind of very new research going into how do we use these to track blood pressure. 30 years from now, we might be able to do that. But as of right now, it's not super common other than a couple flagship things. It can't track your weight. It doesn't know when you're eating or when you're drinking. You can kind of input that in there in some of them, but not really. Calories burned, this might be a little bit of a hot topic. All of these watches are probably going to estimate how many calories it's thinking that you're burning. As the research has kind of come out, it's really challenging to pinpoint a ton of accuracy as far as calories burned with these wearables. It can give you a general range, but it is particularly based off of heart rate. It's usually how they calculate how many calories you're burning. So if you have an abnormally high heart rate, that doesn't necessarily mean that you're burning calories, but it's pulling those calories to look at your working. So it can tell you how many calories it thinks you're burning. I would not say that is exactly what that is. It kind of depends. A lot of the new ones are trying to look at some heart arrhythmias and kind of different patterns. I think that there is some potential in this field in kind of the research that I've looked at and kind of the experience that I've had with these wearables. I would be surprised if this is the end all be all as far as, ECG and EKG and heart arrhythmias and all these different things. Hopefully we get there someday. But as of right now, I don't think that it's the best thing that we're looking at. RPE, you might have heard of that before. That's called rate of perceived exertion. These watches can't tell you how you feel, right? They're still a really beneficial thing to, your watch might say that you are you're super ready to go work out, that you have all the energy in the world, that you recovered really well when you slept the night before. But if you wake up and you feel really sick, or stuff's not working and your watch doesn't show that, it can't tell you that, but you can. And I think that's a really important thing to keep in mind. So that kind of begs the question: how do we use wearables? What is the benefit of using them? And I think first the question that you need to ask is, what do you want your wearable to be able to do? How do you want to wear it? What sorts of things are you looking for it to be able to do before you can decide, how much should I wear one? Should I get one? Right? I think finding out what you're actually wanting it to do is really important. And kind of like I touched on in the last slide, wearables should be a tool, and I want everyone to think about wearables as a tool, as opposed to this kind of governor, right? That if I don't do this, if I don't meet my steps goal, if my heart rate's a little bit high, whatever, that it means I'm not, improving my health. Or, even on the flip side, if my watch said I burned 5,000 calories yesterday, well, did that actually happen, or is your watch just telling you that? And so when we think about, how is that, how is it affecting our lives? I think that using it as a tool, as opposed to the end all be all voice, for health, is important. And then I kind of touched on this already, but tracking your progress, I think that's the best feature that these wearables have, is the ability to look back, a couple months in the past, or even a couple years in the past, and see, okay, how have I done, right? Am I improving? What sorts of things are changing? Is my resting heart rate going down? It's really good at tracking that. Am I getting more steps per day? Am I able to, walk another mile, an extra mile this month as opposed to last month, or something like that? That's really helpful. And then another big point: consistency is key. And when I say consistency, I mean consistency in wearing these things. Like, if you're going to do it, granted, you don't have to wear it all the time. However, you got to think, like, when you're wearing these things, it takes some time for these wearables to get used to your movements, to your patterns, to what you're doing, and kind of almost like zero itself on you. And so the more that you wear it, the better kind of data it's going to give you. And also, you're going to have more kind of data points long term to be able to track your progress. So those are kind of some of the main things. Figure out what you want it to do. Don't let it be the big voice in your life. Be able to track your progress and look how you've done over time, and then actually wear it. So, do I get one? Should I get one? Maybe I already have one. Should I wear it? Should I not? I think it really depends on you. I don't know. What are you looking for it to do? Are you somebody who you're starting your exercise journey, and you don't really know where you're at? You don't know kind of the exercises that you should be doing, whatever. I think they could be a really beneficial thing. You can start to see some of those motivating factors, right? You see your steps going up, you see your resting heart rate going down. Maybe your sleep starts to get better. I think that's a great case to use a wearable. Maybe you're getting into some more intense exercise, like if you want to be able to track your pace, if you're running a marathon, or if you are getting into riding your bike, something like that. That's a really, really great way to use these things, especially in the kind of Apple Watch, Garmin, Coros field. So yeah, what do you want to use it for? And if you feel like that would be something that could help you, then yeah, absolutely, go ahead and get one. Basic recommendations as far as the kind of categories that we have. If you're somebody who is looking for something to keep you safe, maybe you have a family member that might have fall risk or something like that. These can be a really great solution. I've seen folks, especially recently, I've seen a lot of people coming in with these as fall prevention. Granted, I don't think that Apple will say we will detect every single fall that ever happens, but I think using that as an extra level of security could be personally if you're someone who's like, hey, I'm going to get into exercise, I'm doing triathlons, I'm doing marathons, something like that. I personally think that the kind of Garmin Coros area is a little bit better, but then in that middle range there, that kind of lifestyle, maybe you're just kind of using it to go on some walks, or lift some weights, or trying to see how is your lifestyle improving. That Apple kind of Fitbit, Samsung, and I'm sure some others are really great solutions, as well as I feel like a lot of those Apple, Fitbit, Samsung, that's where you kind of see a lot of that tech, that cool new tech coming out. So if that's your jam, that's a good place to start. Okay, so overall, Should you get a wearable? I don't know. However, they can be a really, really good tool, right, to help us gain insight into our overall health. We can learn a ton of things about what's actually going on. Is your VO2 max improving? If you know that metric, they can track that. Is your sleep getting better? A lot of these things will give you even like sleep scores, and wearing them a lot will help that to kind of improve over time. However, these things have some accuracy limitations sometimes, right? Even if you're going to spend two, three, four, up to $1,000, two, three, 400, up to $1,000 on these things, they're not the end all be all, right? They are not, in the place of a doctor or, really sound kind of medical care. They can give us ideas as to trends. How is our life improving? How is our fitness improving? How is our health improving? Yeah, there's lots of ways that yeah, it can do some things, but it also can not do some things, right? It's not going to tell you your weight. It's not going to be able to look at your blood pressure, all those kinds of things. The other big thing, wearables shouldn't tell you how you should feel or how you do feel. The thing that is most important when we look at how you actually feel is, what is your body telling you, right? I think a lot of people who wear these wearables and wear them every day can kind of lose that self-efficacy of being able to determine, okay, am I feeling better, right? Or is just my watch is telling me I feel good, therefore I feel good. I think that's a really important distinction to make. I would way rather you actually feel good and then your watch reflects that and you kind of get to, be excited together, or, this flawed wearable has some thoughts about how I'm living, and so that's what I am. And then, kind of my last point here, working with an exercise professional, an exercise physiologist, an exercise medicine specialist, a physician, physical therapist, occupational therapist. I really think that still is the best way to understand your body and to get the best recommendations as far as exercise. These things are great tools, and they have some potential. I think that we're going to kind of see these get more and more accurate over time. And I really do, like I said, I wear one myself and have for many, many years. And it's given me a good understanding into, what's actually going on with my body through my training. But I think it's really important to keep it in the real world and to, maintain the relationship with your physician. If you're working with a physical therapist, exercise physiologist, something like that. So those are my general conclusions. If you're still wondering, hey, do I get one or not, or how should I use this? I think that's very realistic, but yeah, figuring out what should I use this for, or what do I want to use this for? What do I feel like it could help me in is still really important. So I think we're going to give some time for questions. If anybody has any questions, feel free to throw them in the chat. Maybe specific, like, here's my situation. What should I use it for? You're more than welcome. Or if you don't, that's okay.
All right. Thank you, Nick. That was great. Very informative and lots of great information about this upcoming technology and the new and as it's evolving all the time. There's always something new out there on the market.
This whole talk will be completely different in 5 years.
Right. Exactly. So I'm just kind of waiting to see if anybody has any questions to put in the chat. Let me go ahead and stop the recording.